another part of their management plan, which leads us to our next slide here is the comprehensive management for a child with cerebral palsy. And this is really going to be a difficult and very involved undertaking for the family and for their group of caregivers. First, before we get into management, we need to first take a look at a concept referred to as neuroplasticity. This gets a little involved, so bear with me here as I try to explain this here. The brain creates pathways as we learn from early in conception to all the way through early childhood. The brain keeps and eliminates these pathways based on stimulation of brain activity. And when we use the pathway, basically we keep that pathway. If we don't use it, the brain eliminates it. Neuroplasticity is characterized by the ability of the brain to adapt to environmental changes, store the information into memory, and recover from brain or spinal injury. A child's brain, fortunately, has great plasticity, or the ability to change in response to environmental stimulants as compared to an adult's plasticity of the brain. With cerebral palsy, management is a question of timing, the amount of intervention needed, and the outcome of the intervention. The management team for this individual is going to include many doctors from various fields. It's very involved. The need for an accurate diagnosis and effective treatments are critical to the proper management for this individual. Each plan is going to be unique to each child with cerebral palsy and will have three forms. A real rehabilitative form, a medical form, and possibly surgical component of their treatment plan. All right, firstly, let's go through the rehabilitative component. Here, it usually will include some form of physical and occupational therapy. And lately, there's been a shift away from the traditional forms of physical and occupational therapy and more of a shift towards motor learning and strength and fitness training. It may also include some types of serial casting, orthotic bracing, aquatherapy, therapeutic horseback riding, and some technology systems. For most children with cerebral palsy, this process begins in the home environment under the infant and toddler programs within IDEA. And here the emphasis is really going to be for getting the parents involved. So hopefully these programs will be able to prepare the child early on to progress into programs in school, in preschool, and as they move through their schooling throughout their academic career. Okay, let's move to slide 14 and talk about medications and surgeries. There are many different types of medications that are used, and their main goal is to improve motor tone, which will enable more activity for the individual with less pain. The surgeries that involve include both orthopedic and or neurosurgeries for the brain. Some orthopedic surgeries that are commonly used are what's called tenotomies, a tendon transfer, and osteotomies. Some of the neurosurgeries involved are deep brain stimulation and selective dorsal rhizotomies. Okay. Some of these specific rehabilitative techniques that are used are going to be covered on slide 15 as we keep moving here. The most common type of motor therapy is called neurodevelopmental therapy, or NDT. This type provides sensory motor experiences that enhance development of more typical movement patterns and are an individualized program patterned for around this individual, or patterned for each individual. And it's going to be an individualized program of positioning, therapeutic handling, and play. Another specific rehab technique that's used is what's called constraint-induced therapy or forced use therapy. Here, this is very common with hemiplegic CP, where only one side of the body is affected. So in this technique, constraints are placed on the functional limb of the child, and this forces them to use their effective limb and try to get more mobility, more range of motion, more flexibility for that effective limb. Physical activity is also another popular technique to strengthen the bones and muscles of the body, enhance their motor skills, and prevent contractures. Organized physical activities like dance, swimming, horseback riding are very beneficial. And let's not forget about probably the most popular one, the Special Olympics, and how beneficial this organization is for many of these individuals with cerebral palsy, and probably one of my more favorite ones. Bracing splints and positioning devices are used frequently in many children's rehab also. These orthotic devices and positioning devices are used in pursuit of their functional goals of each child with cerebral palsy. They help to maintain adequate range of motion, prevent contractures at specific joints of the body, provide stability for the individual, and control involuntary body movements. An example of a leg sprint is an ankle-foot orthosis. This stabilizes the foot while putting the Achilles tendon in a constant stretched position. A resting hand splint is a common type used for hand issues, and body splints are used for the torso to promote skeletal alignment. Proper positioning devices or seating devices are unique to each individual based on their age and their functional status. For example, say we have a child that is in a wheelchair for extended periods of time throughout the day, and they're going to need a very specialized seating system to ensure proper positioning for them in their wheelchair and to prevent further issues or injuries for them. Okay, next let's go into some of the adaptive equipment that's being used. There's a wide variety of adaptive equipment that is available for the individual with cerebral palsy, and they're going to be based on the child's mobility. So let's start with individuals that can walk. Equipment that's called the left-strand crutch. It is the crutches that go on the forearm instead of underarm crutches that are very normal, okay, or popular, I should say. And a posterior walker instead of a walker in front of the individual are two very common types that are used, again, for children with CP that have the ability to walk. Wheelchairs, on the other hand, are essential for those that have some limited walking ability. Some of these wheelchairs may need some modifications. Modifications may include added head or trunk support. They may need additions of trays in the front for any other adaptive equipment like computers or page turners or word boards, things like that. And some even have the ability to recline to as far up to 10 to 15 degrees if need to be. Motorized wheelchairs are going to be very critical for individuals that have no ability to walk. Here they're controlled by either hand motions, head controls, or even mouth controls. And many include leg elevation equipment and tilt options for pressure relief for the person, self-positioning, and lower extremity stretching. So those are critical parts here, again, to make them as comfortable as possible. Another type of adaptive equipment is what's called supportive strollers, and these are used for very young children since their mobility issues may not have been identified yet, and they're sometimes easier to use and move around in the community. When with the young children being so small, they'll be easier to use. Some assistive technology that's used ranges from a simple piece of Velcro all the way up to computer chips. And many say that the simpler the equipment, the better. But that computers are the way of the future. Even equipment that is very popular here, the iPad and the Wii, these are being used a lot for their ease of use, the graphics, how great the graphics are, and for the amount of applications that are available to use with them. So it's very, very popular here for adaptive equipment.